People ask, what are the risks of KAMRA surgery? And well, what one needs to understand is that with all eye surgery, there are risks. The risks involve infection. We use state-of-the-art and very powerful antibiotics to reduce the risk of infection. And we see extremely low levels of infection in our corneal surgeries today, probably because of this. The procedure itself involves placing a tiny little inlay directly over the spot where you look through the center of your cornea. And I've been working diligently, doing my own research, to try and improve the methods to make sure that this little tiny inlay ends up exactly over the spot where you look through your cornea. And this is a procedure that involves watching the light come out of your eye as I'm centering this little inlay into your eye. So if that inlay were to find its way a little left or right or up or down at the perfect spot in your eye, it is quite simple to go back in and recenter this implant. And I've even invented an instrument to allow this procedure to be done more safely and quickly. So the decentration of the device is the primary thing that we work the hardest at. Very few patients have had to have this inlay removed. In our FDA clinical trials, only 4 or 5 people had the inlay removed. My friend Dr. Tomita in Japan has treated 10,000 of these. He tells me that he's removed about 35 or 40 of these. About half of those were patients who felt that someone could see it in their eye and didn't want to be able to see this thing in their eye. So you can vaguely see the inlay sitting in the front of your cornea, and a very small number of patients were troubled by that and wanted to have it removed. For medical reasons, it's been very, very well tolerated in the cornea. This is our primary focus with the KAMRA, that your cornea tolerate this well. I'm Dr. Richard Foulkes. Call our phone number, 630-724-1400, or go to our extremely informative website, www.glassesfree.com. And remember, there's no charge for your initial consultation.